traveling, so we will get underway. So thank you all for attending our press conference, and to our friends in the media who are down in the press room or in their offices tuning in as well. We want to thank them for tuning in. My name is Mike Woodard. I serve in the State Senate representing District 22, Durham, Granville, and Person counties. We're here today to welcome the North Carolina Consumer and Family Advisory Committee to the General Assembly for their annual legislative day. We have a number of members of the CFAC as well as other advocates for good mental health policy in our state with us today, and I want to thank them for coming, for traveling, some of them distances. We've got some folks from the far western end of the state. These aren't just folks in the Triangle. They came from all over the state to be with us today. So I want to thank you all for being here and for being such great advocates for good mental health policy and mental health care. If you're not familiar with CFAC, the Consumer and Family Advisory Committee, it was established in general statutes to advise the Department of Health and Human Services and the General Assembly on planning and management of the state's public mental health, developmental disabilities, and substance abuse services system. As many of you know, our mental health system has undergone quite a few changes over the last couple of decades. We face a number of challenges in continuing to provide effective mental health services to the residents of North Carolina. And I maintain that CFAC has been one of the best things we've done in providing mental health in this state to advise us, because you all are the consumers and the family members who are receiving the mental health services. You are our front line. You are the people who tell us, our LME MCOs, and all of our mental health providers what we need to be doing. So thank you all for that. This year, the CFAC is visiting legislators, and in a moment you're going to hear from the state CFAC chair. But some of the important points that are critical to the agenda this year include expanding Medicaid, which certainly would increase services for substance abuse as we combat the opioid crisis, and also increasing innovation waiver slots. So that's the top of the CFAC Advisory Committee, the CFAC list of priorities. To continue to protect and strengthen the voice of consumers. Any revisions to the general statutes that created CFAC need to make sure that we continue to have the strong consumer and family input into the state CFAC's work. We certainly want to continue to support efforts to increase rates for the direct support professionals. Yesterday was another what we call white coat days here at the General Assembly, when medical professionals come and spend time with us. And almost to each individual group, this was an issue that continues to be a challenge for our medical professionals, is the rates for their payment. So we have to continue to make sure that we can support our medical professionals, particularly those who are supporting our mental health patients and families. And any organizational changes to the LME MCOs throughout the state should continue to prioritize consumer and family services and providing stability. We do not want to lose, whether it's when we're advising the department or as we continue to reform the LME MCO system in our state, we cannot lose the voices of the consumers and family members. And CFAC is our best tool for that. I would just like to conclude my remarks by being sure to thank our partners in providing effective mental health services. Dr. Cohen and the DHHS staff who have made mental health services a priority in their work, our legislative staff here who provide support to us, and I certainly want to thank my legislative colleagues. And let me mention, I should have at the outset, that I'm joined today by Representative Verla Insko from Orange County, who has been a champion for this issue probably when I was in high school or college. That's how long she's been working on it. I'll let y'all guess how long that is. But Representative Insko has been a fierce champion for all things good in public health, but certainly mental health. And I want to be just like her when I grow up. So. But I want to thank all of our legislative colleagues who have made effective mental health in North Carolina a priority, particularly my colleagues on the Senate Health Committee, Representative Insco's colleagues on the House Healthcare Committee as well. And I'd like to encourage all of our legislative colleagues to engage the CFAC members in their districts. And I hope they will take time either today before they leave town for the weekend, or I know some of you all are making appointments with your legislators at home and follow-up visits next week. So I'd like to encourage all of my legislative colleagues to find time to engage the CFAC members in your district and to spend time thinking about the mental health issues that our state faces, and as we finalize our budgets here in the next few weeks, how we're going to continue to support those. With that, I'm going to step aside and introduce another great advocate for mental health, the state chairman of CFAC, Benita Purcell. Benita?
Thank you. Thank you. I'd like to thank all of you all for being here today. I think our numbers are fewer today maybe, but I think our voices are stronger. This is our second year of doing this. I think we learned from last year, and I think we all feel more empowered now to actually go out, visit our members, our personal members from our counties, but also to expand out and reach to other members of the General Assembly. I'm not going to say everything that Senator Woodard said, but I do want to stress, and I will be very transparent, I work for a provider, and I have been a sister and a family member for 53 years. So when I'm here, I am totally representing our population and not an agency. But I also am HR director for the agency that I've worked at for 30 years now. So I can speak very openly about the issue that we are seeing statewide and nationwide in regards to direct support professionals and the shortage. When you can go, and I think I mentioned this last year, and we've not made a lot of progress, when you can go to McDonald's or Target and make $10 and $12 an hour, and then you go to a group home system where you are providing hands-on care to individuals, our most vulnerable citizens, at $8.50 and $9 an hour, where are you gonna go? It's a revolving door, and when that happens, we are not getting positive outcomes. We are not using taxpayers' money wisely, and we've got to find a way to make that better. I'm not sure how we can do that. I think the expansion of Medicaid will help that, but I do challenge our members, as well as the members hopefully listening, to really look at how we can stabilize funding, how we can ensure that we can increase wages so that we can get positive outcomes, and that individuals know who their staff is going to be, and it's not a revolving door. It's a huge challenge. It is a national issue, but it's something that we really have to look at. If the state of North Carolina can pay their employees working in state-funded facilities $15 an hour, that makes it a lot more difficult for people in the community. And isn't that where we want our people to be? We want them to be in our community, in their communities. You know, we're not going to be able to downsize and close the psychiatric hospitals and the Murdoch centers if we can't provide that care in our communities. And at $8.50 an hour, you can't do that. Now, a lot of people may think providers are making money. I work for a nonprofit. Our staff have not had raises in years. And if you look at our annual budget, we are not making money. In fact, a lot of providers are providing services for free because it's the right thing to do and because we care. So we really need to stress that. North Carolina is getting ready to undergo massive reform, going into standard plans and in future tailored plans. Stay on top of what's happening. I'm gonna say I don't trust anybody at this point, so I'm asking our members of the General Assembly, watch what's happening with the division. I think they've got a good plan, and I think they have learned from what happened with some of our LMCOs. I think they are doing better, but stay on top and really monitor closely, because we wanna make sure that this is successful. North Carolina cannot fail in this endeavor, because if it does, it's gonna impact the lives of many, many people. I encourage you all to get involved in your local CFACs. If you're not, come to state CFAC meetings, reach out to us. Let us know what we can do. We are trying very hard to work more closely with the local CFACs and have monthly phone calls. We're having a lot more people attend our state meetings. We meet the second Wednesday of every month. And we are really trying to stay on top of everything that's happening. But if there's things happening in your area that we can do that maybe we don't know about, please reach out to us. And it's really critical. 122C, I don't know what you all know about this, but we've talked about how antiquated that law is. I mean, it was in effect with area programs, and we are now well past that and getting ready to transition even more. We are being told it's being worked on, but we don't know who's working on it. We want to make sure our voice is there, and we want to make sure that state CFAC and local CFACs remain in there. We have the Medical Care Advisory Board. That's a requirement, but that's not going to take the place, we hope, of state CFAC and local CFACs. You need people on the ground in the communities getting the information to you all to make decisions. So I want to thank you all for being here. I want to thank Representative Ensko for coming, and she has truly been a champion of local and state CFACs since the creation. So we thank you for that. And thank you, Senator Woodard. He's always around doing our town hall meetings in Person County. So thank you.
So, well, thank you very much, and I really do appreciate all of you being here and encourage you to keep up the annual visits and to expand your numbers. The numbers will make a really big difference. I'm going to comment just a little bit on some of the things that have already been said. I really actually did not know that the providers were making, the direct care providers were making $8.50 an hour when our state employees. I think other legislators need to know that. I thought I was really well informed, but I did not know that. I would like to add that the current majority is leaving about $1 billion on the table that they could dip into and spend for some of these services. And I hope that as you visit state legislators that you will remind them that they have certainly $700 million and probably another $300 million coming for a total of $1 billion. Now they're going to put some of that into a tax cut, but when we do not need to be cutting taxes when we have such significant deficits in our essential programs, and state legislators have the authority, the responsibility, and the power to fix this. And so that I think you should be reminding your state legislators of that too. So I also want to say that the state CFACs have a very important role to play in our system, and it is very important as we make this transition so we're transferring a lot of people to Medicaid managed care, which will be provided by the private sector. So we have had 100% public sector so far, public money, public sector provided services. Now we have public sector going to the private sector for services. So it's really important that we develop relationships with those private sector providers as well as the public sector providers. So I'd add that, if I could give you another to-do on your to-do list, it would be to intentionally get acquainted with that population too, and make sure that we have the statutory authority to do all of that and to stay involved that way. Just in closing, I would say that what really does speak to me is a simple phrase that I think that I've learned since I've come here, and that is nothing about me without me. And all of our population that have any disabilities or special needs of any kind have really the right to be engaged in all the decision making about them. It's their lives, and we need to. And you all help represent that for our mentally ill, and so it's for our developmentally disabled and our people with addiction disease. So your work's really important, and I really greatly appreciate all that you do. And please stay in touch. But see your state legislators and vote.
Perla, thank you. As I said, you have been a champion on this for decades, and so thank you. Colin, questions?
You mentioned earlier 122C, an antiquated law. Can you elaborate a little bit on what that involves and what the problems you see with that are?
Do you want to do that?
Yeah, so 122C is the statute that deals with behavioral health. And it was, it was actually created probably originally in the 1980s or 90s, maybe even back to the 70s, when we created area programs. So as we move into the transition with private sector managed care that's gonna do Medicaid, the question is, will there be anything in 122C about the private sector? Because right now it just deals with the public sector. But it actually is a fairly long and complicated statutory chapter that covers the entire all the entire public services that are provided, and directs the management of all of the agencies that provide those services.
The only thing I would add is General Statute 122C, 170, and 171 addresses state CFACs and what their legislative obligations are, and local CFACs. But it definitely addresses area programs, LMEs, as we've changed, the language has not been brought up to speed, and now going into the public sector.
And I
It
think
may not continue.
one of the questions is will we bring in any of the private sector language into 122C, or will that all go into Medicaid statutes? And that's what the department's working on. I haven't seen it, the update yet.
One more. You talked a lot about in this press conference Medicaid expansion. Is that considered an official legislative goal for CFAC, or is that sort of just a thing that a lot of folks here are hoping to see?
CFAC would very much like to see Medicaid expansion. We believe that would be a way to eliminate some people on wait list. I mean, North Carolina has a huge number of people on wait list for services, and those are just the people that have been identified. We truly believe that there are a lot more people not identified on that list. And just me personally, but I think the rest of the CFAC people in here would agree that it's a shame that North Carolina is not being a little more pushy with getting things done. We need to provide better services to individuals with special needs, mental health, IDD, substance use. If other states can do it, we can do it. We need to learn what's worked in other states, what has not worked, and not make those same mistakes. Like I said, we can't afford to let what's happening now fail. With going totally public, it's scary, it's happening fast. We've had a lot of time to prepare for it, but it's still going fast. And if anything fails, it's gonna be lives that are impacted.
So, maybe everyone knows Medicaid is just for poor children and age-blind and disabled. And so if you are a childless adult, it doesn't make any difference how poor you are, you don't qualify for traditional Medicaid. But under Medicaid expansion, all those uninsured childless adults would be covered. And that would, a lot of our mentally ill that are not being served now are those childless adults.
That's right.
And even for the parents, even if you have children, we only cover that population up to about 140% of the federal poverty level. We cover children up to 200% of the federal poverty level under Medicaid and Health Choice both. But parents are only up to about 40% of the federal poverty level. So even a lot of those parents would be covered under Medicaid expansion. Smart move.
All right.
I have a question.
Yes, sir.
With the Medicaid expansion, if that comes in, and North Carolina already has a problem with health care and trying to take care of the people that are on waiting lists, how is putting more people into the system gonna help the people that are looking for services now?
Well, if we were to expand Medicaid, we would get a lot more funding that would come into the system, and that would create jobs in the medical profession. We've got a lot of good medical schools here. We've got a lot of people who would qualify to take those jobs. I actually think that Medicaid expansion would also help force up some of these other provider rates. So that's another option, a good outcome of that.
And there have been any number of studies that show, even county by county, with expansion, closing the coverage gap with the funding that would come in on that, increased jobs, as Representative Insco said. So not just at our big medical centers, but also in our small town, rural county hospitals, where a lot of folks are in need. So being able to add positions there to assist would be
But how
come
does-
as a result of that expansion.
How does that take care of the people that are on a waivers list, waiting to get the waiver, people that are not,
Yeah.
you know?
So the waiver, of course, is, waives the Medicaid basic plan. And so in order to get the waiver slots, we need to provide the state funding up front. So just regular Medicaid is an entitlement, and if you, the state has to pay if you're eligible. And so you're eligible for an innovations waiver, the state has to fund those slots. And so we need to put money into those slots. We have, what is it, 12,000 people on the waiting list?
About 13, whatever, yeah.
And we're serving about that same number, and those slots, so we need to be adding those slots every year. And that's another thing to, I think, be a strong advocates for. It is less expensive to pay for those people through a waiver slot than it is through the way we're doing it right now. We're not being smart with how we're spending public dollars.
How many waivers are gonna be added or anticipated to be added in the future?
Well, there are two, I think there's a bill in the Senate that adds 1,000 slots, you know,
Yeah.
and there's a House bill, I think, that adds 150. So I think that negotiation, I hope, will be worked out, well above 150, but closer to 1,000. And as we say, there's money free to pay for it.
Okay. All right. Well, thank you all again. I want to thank Benita for her continued great work and advocacy as chair of the CFAC, all the CFAC members who are here, and other consumers and family members who came today to join us. Again, I want to thank Representative Insco for joining us today and for her incredible work and advocacy on this. And again, I hope you all have a great day visiting with your legislators, and we look forward to seeing you out in the community and around the building again. Have a good day, all of you.